The nursing program at Webster does help deepen the nurses' practice. So they come to us with a foundation of nursing skills, starting IVs, things like that. We build upon that and give them a more global picture of nursing. A lot of the facilities, especially in the St. Louis area, but many facilities across the country, are pushing for nurses to have a BSN as a beginning degree.
I was already a professional functioning nurse, but what it did was it expanded my horizons and enabled me to be able to read statistical reports and research and be able to discern if it was good information. I couldn't really go any further in my nursing career without a BSN.
One of the things that makes our RN to BSN program unique is the amount of content that we spend on the social determinants of health, which are those factors that impact patients' health that is not related to acute care. A lot of people tend to think of nursing as a hospital, but there's so much more to that.
It also broadened my knowledge about community-based nursing. It was a great segue for me to return to volunteering in the community, and now I volunteer every weekend at a food outreach in preparing meals for people with HIV and cancer who are unable to prepare their own meals.
They will have a much bigger picture of their patients' families, and the environment in which their patient comes from and goes back to. It's 100% online, and if you run the class in a way that you are going back and forth with students, talking with them throughout the week, I find that I get to know them better than I did one night a week in the classroom.
You can break it up during your day. If you have some downtime during the day, you can access your studies and work on it at that time.
So online, but we're available.
For me personally, Webster University was a small enough community I didn't feel like I got lost and felt well supported, as well as developing personal relationships with my classmates. I just don't think I would have had that in a large university setting.